The equipment, worth 720 million shillings, includes 31 motorcycles for surveillance in refugee-hosting districts, 3 ambulances to be attached to government health centers in risk-prone districts at the border with the Democratic Republic of Congo, and a thermoscanner to be deployed at Entebbe International Airport to screen all departures.
There are much more resources, not enough, by the way, to ensure that indeed we're fully prepared should Ebola reach the Ugandan shores.
2 people have died in Uganda since cases from the most recent outbreak in Congo were first reported in Uganda, and the Ministry of Health says the risk remains high despite the containment efforts.
Because from time to time we get people sneaking into Uganda and leaving us with contacts that we have to follow up and to immunize.
Health officials had structured a 1-year response plan expiring in September, which required $17.2 million to be implemented, but only 30% of the funds were realized. Although the Ebola threat has not been as high as earlier anticipated, the response period is being extended because of the persistent threat from across the border.
And so we have a running preparedness plan to enable us respond to the current Ebola threat.
Over 7,000 people have been vaccinated against Ebola in Uganda since the outbreak in Congo, and the minister hopes the new Ebola trial drugs can cause a difference in Congo and lower the threat to Uganda.
The rate of response with this drug is quite acceptable, and so we do hope that it will have an impact in the DRC and we shall start seeing a decline.
According to health officials, Uganda can be declared Ebola-free only if it's totally eliminated in the neighboring DR Congo, which is why equipment and more logistics are needed for rapid response just in case. Edward Muhumza, NTV Tonight.